Dr. Crayle, can you shed some light on the difference between a Lumineer and a veneer? To me, there seem to be both of them clip-on fingernails or clip-on tooth nails, ceramic things. But apparently there's a difference, and frankly, it looks like lots of patients out there are confused of what is what and which one is better for what. Tell us a little bit about it, please.
Well, a veneer, in some respects, is like a false fingernail. It can cover up a tooth. It gets bonded onto the tooth. It's made out of porcelain, and it can cover up a crack or change the shape, the position, the color of the tooth to make it look more in line with the rest of the teeth, to give the person the look that they desire.
Right. And what about a Lumineer?
Okay, a Lumineer is a veneer. That's just a particular brand of veneer. There's many brands available.
I see. So it's a brand. But I have heard that some people say with a Lumineer you don't need to shave or grind the tooth down, and thus you don't need any, number one, you're not damaging a perfectly good tooth otherwise, which maybe just be discolored or whatever it might be, and you might not need any injection, which again to most of us seems to be a plus. Is there something to it, and does that have any advantage at all? What's the deal there?
Well, in some cases, veneers can be done without any grinding, without any anesthetic injection. That's true. But in some cases, it is necessary. It depends upon the individual situation in terms of the position of the teeth, in terms of what are we trying to correct. Is it something that's, just on the surface, or is it something that's deeper within the tooth? It depends on the bite and the final result that we want to create.
Got it.
So sometimes it's necessary, sometimes we can do without.
I see. So, all right. So basically, a veneer and a Lumineer really are the same thing. Slightly different brand. Like a Rolex and a God only knows what other watch, which is just two different things. Both of them give you the time. Both of them make you look better. And you, the dentist, were more or less kind of like, choose which brand would fit that person at that moment better. If you can get away with a Lumineer because it will look just fine and you don't need to do extra grinding and extra anesthesia, you might use it. Otherwise, you might use another brand. It's not important for the patient, is what I get from you, which one is which one. It's really just a technical term. Am I right there in that assessment?
Right. The whether it's a Lumineer or a non-Lumineer, it may or may not need to do any grinding. It may or may not need any shots. Like I say, Lumineer is just one type of veneer. There's many kinds out there.
Okay. So basically, once you put a Lumineer or a veneer on my face, my coworkers will not know what you did, and it won't make a damn difference to me. In terms of pricing, I assume it's in the same more or less range also, because it's just more or less a different brand for doing the same thing.
That's correct. Yeah, the goal is to make it look like natural, beautiful teeth.
Good. Well, all right. Thank you very much. Very informative again. Thanks for your candidness.